Hi, this is your host. Today, we're going to answer the question, what is Alzheimer's disease? Alzheimer's disease is a progressive neurodegenerative disorder that is characterized by a gradual decline in cognitive ability and behavioral changes. It is the most common cause of dementia, accounting for 60 to 80% of cases. The hallmark pathological features of Alzheimer's disease are the accumulation of amyloid-beta plaques, which are extracellular deposits, and neurofibrillary tangles, which are intracellular aggregates of hyperphosphorylated tau protein. These two abnormalities cause neuronal dysfunction and death, leading to brain atrophy, particularly in the hippocampus and cortex. The disease is thought to begin 20 years before the onset of clinical symptoms, and the rate of progression varies, but the average survival after diagnosis is 8 to 10 years. The causes of Alzheimer's disease are complex and not fully understood, but it is considered to be multifactorial. While the average age of onset is 65 to 75 years, and age is the primary risk factor, there are also genetic and environmental factors that play a role. Mutations in 3 genes, namely APP, PCN1, and PSEN2, have been associated with early-onset familial Alzheimer's disease. In addition, the APOE4 allele is a well-established genetic risk factor for late-onset Alzheimer's disease. The amyloid cascade hypothesis proposes that the accumulation of amyloid-beta peptides, which form the plaques, is the primary driver of disease pathogenesis. However, recent studies suggest that tau protein and its aggregation into neurofibrillary tangles may also play a central role, and there is evidence to support the tau propagation hypothesis as well. The clinical presentation of Alzheimer's disease involves a progressive decline in cognitive ability and behavioral changes. Early symptoms may include mild memory loss, difficulties in learning new information, and disorientation. As the disease progresses, symptoms worsen and may include language impairment or aphasia, difficulty performing daily activities or apraxia, loss of recognition or agnosia, as well as behavioral changes such as agitation, aggression, or psychosis. Eventually, individuals with Alzheimer's disease become severely cognitively impaired and dependent on caregivers. Diagnosis of Alzheimer's disease is primarily clinical and is based on the presence of cognitive deficits and the exclusion of other conditions that may be causing similar symptoms. Neuroimaging techniques such as MRI or PT scans can help to identify brain atrophy and measure the amount of amyloid beta in the brain. Additionally, biomarkers such as tau protein and amyloid beta peptides can be measured in the cerebrospinal fluid, and cognitive testing can help to assess the extent and severity of cognitive deficits. Currently, there is no cure for Alzheimer's disease, but various pharmacological treatments such as cholinesterase inhibitors, donepezil, rivastigmine, galantamine, and the NMDA receptor antagonist memantine can help to manage the symptoms and slow the progression of the disease. Monoclonal antibodies targeting amyloid beta, such as aducanumab, are also being investigated as a potential treatment for Alzheimer's disease. Supportive care, cognitive stimulation, and caregiver support are also important components of managing Alzheimer's disease. Alzheimer's disease is a major public health issue and represents a significant social and economic burden globally. Early detection and treatment of the disease may help to slow its progression and improve quality of life for individuals with the disease and their families. Continued research into the causes, mechanisms, and potential treatments for Alzheimer's disease is crucial for improving our understanding and management of this complex and devastating disorder. In summary, Alzheimer's disease is a complex, multifactorial disorder characterized by the abnormal accumulation of proteins, progressive neurodegeneration, and a gradual decline in cognitive ability leading to dementia. Further research is necessary to fully elucidate the underlying mechanisms and develop effective treatments for this devastating disease. Support for patients, families, and caregivers is essential in managing the challenges associated with Alzheimer's disease. If you found this video helpful, please leave a like and subscribe for more medical education videos. And, as always, thank you for watching.